Hi, my name is Shannon Hearn. This is my second part to my final assessment video. I wanted to cover several more things to include the vascular system, assessment of the deep tendon reflexes. Those were assessed in the last video but not scored. I wanted to make sure I completed that. Vascular coma scale, I wanted to score that. Discussed it in the last video but did not score. And then as well as making sure that we complete a no breast exam and do a return demonstration and some education on that. So first, before I do anything, I want to make sure I introduce myself and my patient. I'm Shannon. Hey, Luke, I'm going to be assessing a couple things with you today. All right. So next I want to make sure that I wash my hands. I'm going to sanitize. I'm going to be looking at the bilateral lower extremities on this vascular assessment, making sure that the skin is consistent in color. It is. It's pink, it's warm to touch. Okay. Hair is evenly distributed on both legs, as well as there's no obvious edema, no edema or pitting edema noted. Don't see any superficial veins, don't see any varicose veins. The items that I was just looking for, any of those that were noticed would be indicative of or could be indicative of peripheral artery disease or cardiovascular disease. So the vascular system on Luke looks healthy, no abnormalities or noted. The next step in this assessment, again, I wanted to reassess the deep tendon reflexes. I want to make sure that I score these appropriately. I'm using my stethoscope, and because I don't have a reflex hammer, Luke, if you could, yeah, thank you. +2. +2. We come up to the upper extremities bilaterally again. Okay. So the vascular coma scale, the first step in that, and again, we've already assessed this, so I just want to make sure that I score for you appropriately, but Luke's able to look at me, he's able to have his eyes open, so he'd get a 4 for that. The next step is that he was able to answer questions appropriately. He told me about surgical history when I questioned him in the last assessment, and he gets a 5 for that. And then he also was able to obey commands. Had him do heel-to-toe test, had him put his feet together for the Romberg test. I had him do the Snellen eye chart test. He gets a 6 for that. So overall total score was a 15. That is a normal score for vascular coma. So no abnormalities were noted there either. The last step in my assessment that I wanted to make sure that I completed for you today is a breast assessment. Luke, I just want to make sure that you're aware that breast cancer and any breast abnormalities can happen in men just as they can to women. Okay, so it's important for you to know how to properly assess your breast, and you want to do this bilaterally on the anterior thorax or anterior chest, front of the chest. And then also get regular breast exams as well. First and foremost, with the assessment, you always want to inspect. So I'm inspecting my patient's anterior thorax in the breast area. Normally, you have your shirt off. You would just notice the nipple area, note if there's any discharge. You can squeeze, make sure there's no lumps or masses for the next step, but there's nothing visual that I see. So Luke, what you would start by doing is just starting at the upper portion, working your way down. Everyone does this a little different. You can do it in circles. The more you do this, the more often you'll notice your breast tissue and how it feels. So abnormalities would be more apparent to you at that point. Don't feel any lumps or masses on the anterior portion. I do want to do the axillary area on this side, so I'm going to have Luke lift and put his hand behind his head. Now, another way I can do this is have him hold his arm out while I'm feeling, but I'm going to have him do this. put it behind his head. And again, I'm just feeling an axillary or underarm area break. I'm palpating, no lesions or masses are noted. Sorry. All right, you can put your arm here. I'm going to do this on the other side. All right, you can lift your arm up. No lumps or masses were noted there. Now I'm just assessing, palpating, the axillary area, underarm area. We're going to do this on both sides. No lumps or masses are noted. Now, Luke, if you could just do a return demonstration for me and do this on both sides. Lift your arms and bring them together. You can do this in the shower, in front of a mirror, whatever's comfortable for you. Lie down in bed, just as long as you do regular assessments. Well, that concludes my final assessment video. I appreciate your time and allowing me to amend my original video. And thank you, Luke, for your time today as well. Have a great day.